All right, so Trinae Higgs again, and now I will be presenting how to insert a catheter. All right, so in a female point of view, or from a female perspective, so of course, when you first initially get to the patient, you're gonna identify yourself, introduce yourself, identify the patient, identify the orders, and make sure they have no allergies, or make sure you obtain the allergies or whatnot. Assess the vaginal area to make sure there's no irritation or anything like that. And make sure you gather all of your things you need and provide privacy. So in the midst of all of that, once you're in, you're going to make sure you have your appropriate PPE on, and then you're going to wash your hands before you apply the gloves. Wash your hands, apply gloves, and then have the patient laid in a supine position, and you're going to place a drape or either some kind of towel or something up underneath her to make sure that she doesn't mess the bed or her linen up or anything like that. You're going to get the case, the packaging, and you're going to use the surgical obstetrics. I hope I'm saying it right. Method, obstetrics, surgical obstetrics. You're going to use that method, and you're going to don your gloves, and then you're going to, once you do that, you're going to put the iodine on some gauze and cotton balls, and then you're going to also put the lubricant inside of, like, in a little spot for the catheter, to lubricate the catheter. And you're gonna have the patient open it, let them know exactly what it is that you're about to do. You're gonna have the patient open her legs, and then you're going to proceed to open up the labia. And when you open the labia, you're gonna open the labia with your non-dominant hand, and you're going to cleanse her front to back with the iodine. Before you do that, make sure you assess the patient. Make sure there's no any kind of redness or any kind of infection, anything that you see. So, before you do that, you're going to do that. And then you're going to actually get the catheter with your dominant hand. And make sure you lubricate it. And I didn't have a cup or anything like that, so I got these too. I'm sorry. So, gonna open it up and act as if you're cleaning, and then you're gonna look for the meatus, and you're gonna get your catheter, and you're going to tell the patient to take a deep breath in, deep breath out, and then proceed to go in. And then you're going to keep going until you see a flash of urine. And once you see a flash of urine, you're going to continue 2 to 3 more inches. And then you're going to place that there. Hold it with the non-dominant hand. And with your dominant hand, you're going to go back and get the 10 millimeter syringe. And you're going to twist it onto the other end, the balloon end of the catheter. And you're going to proceed to inflate the balloon. And once you do that, you disconnect it. Making sure you securely holding the catheter in place. You're going to disconnect it. You're going to tug it a little bit to make sure it's having some kind of resistance so it won't come out. And then, I think I answered it. So then you take, So then after that, you're going to, take the syringe out, put the syringe down, and then you're going to actually put the side of the end of the catheter. You're going to attach it to her thigh with a little Velcro strap. And then you're going to hang the little Foley, the bag, the urine bag. You're gonna hang it below her bladder. So usually I always be like kind of on the side of the bed. And then you're going to discard your gloves. Then you're gonna discard everything and then discard your gloves. Wash your hands and then apply more gloves on, and then you're gonna go back and assess the patient, make sure everything is okay. Put the covers and everything back on her, and give her the call lights, lower the bed, make sure she's okay, and then you're gonna document everything. And for a male patient, you would pretty much do the same thing leading up to when you clean their meatus. You're going to go from the meatus outward on their gland, and if they're not circumcised, of course you pull the foreskin back and do that. And then you're going to also do the same thing. You're going to go anywhere from like 7 to 9 inches deep down, and then until you see some a urine flash. And you do the same thing with the balloon. You're going to get the 10 millimeter syringe, push it in, inflate the balloon, take the syringe off, make sure that the catheter is secured in place, and then you want to also put the other end of the catheter, attach it to their thigh, and then hold the bag, have the bag lower than their bladder, and usually, like I said prior, is usually on the bed, the side of the bed. Removing it. So when you remove, you're gonna, of course, have the same thing. You're gonna introduce yourself, let them know what procedure you're about to do. Wash your hands, get get the appropriate supplies together. Don your gloves, and then you're going to have them open, female perspective. Have the female open her legs up, and then you're going to get the 10 millimeter syringe, and you're going to attach it to the end, the colored end. And I don't remember, but I'm just gonna say I would clean the perineum first. I will do that first, and then proceed to put the 10 millimeter syringe on the colored end, and pull the plunger back to get any air, any urine, or any fluid, anything that's inside of the balloon. And then tell them to take a deep breath and take the catheter out. And then after I do that, I'm gonna assess and make sure that there's no kind of irritation or anything, or the skin and everything is intact. I would discard everything from up under her, throw everything away, throw away my gloves, wash my hands, go back and assess the patient by pulling the covers and everything over her, giving her the call light, ask her if everything is okay, and then I will proceed to document what it is that I did. The male, the same way, the same thing with the, I will clean them first, and take the syringe and pull the plunger back to get any excess, any air and excess urine or fluid, and then have them take a deep breath, pull it out, and do the same thing, clean them up, and wash my hands. After I take my gloves off, of course, wash my hands, and you have to apply another pair of gloves on, and then take care of my patient as far as like putting their covers back on them to, for everything, and then putting the covers back on them and giving them a call light, and taking my gloves back off, washing my hands again, and documenting everything that I just done. I hope you enjoyed my thing. I did a lot of studying. I tried my best to memorize everything that I could. So you guys take care and be safe and be blessed.